A plus blood, found in about 34% of the U.S. population, features A antigens and the Rh factor, allowing individuals to receive A plus, A minus, O plus, and O minus blood. However, they cannot receive B plus or AB plus blood due to immune reactions against B antigens. A plus individuals are also excellent candidates for platelet donations. The A plus blood type is genetically influenced, typically arising from parents with A or AB, and another with AB or O could potentially result in an A plus child. Studies suggest that A plus blood individuals may face a higher risk of cardiovascular diseases and severe reactions to certain pathogens, like norovirus. Additionally, research indicates mosquitoes are more attracted to type A blood compared to type O, though these differences are subtle and influenced by factors like skin bacteria and body odor. Overall, blood type is just one minor factor in a person's health. There's a misconception that A-plus individuals should follow specific diets, such as vegetarianism, based on unproven ancestral patterns. Culturally, especially in Japan, people with A blood are often viewed as responsible and meticulous, but these associations lack scientific backing. Overall, both dietary and personality claims related to blood type are not supported by evidence. A negative blood is much rarer than A+, with only about 6% of the global population having this type. Unlike A+, A negative lacks the Rh factor, making compatible blood donations more challenging. A negative individuals can receive A negative and O negative blood but can donate to A+, A negative, AB+, and AB negative recipients. For pregnant women with A negative blood, there's a risk of Rh incompatibility if the baby has Rh positive blood, which can lead to hemolytic disease of the newborn. To prevent this, Rh negative pregnant women typically receive a shot of Rh immunoglobulin. Research suggests that A negative blood may lower the risk for some infections, but increase susceptibility to others, such as H. pylori, linked to stomach ulcers. However, A negative individuals may have a lower risk of malaria. Despite myths suggesting that Rh negative individuals, especially A negative, possess alien traits or powers, there is no scientific basis for such beliefs. Although the rarity of Rh negativity can spark fascination. B plus blood is present in about 8% of the global population and features B antigens on red blood cells along with anti-A antibodies in plasma. Individuals with B plus can receive blood from B plus and O plus donors and can donate to B plus and AB plus recipients, making them good candidates for plasma donations due to their antibody composition. Genetically, if one parent has B or AB blood and the other has B, AB, or O, their child may inherit B+. The B antigen is dominant, increasing the likelihood of its transmission. B+ individuals are more susceptible to certain infections, such as urinary tract infections caused by E. coli, but they may also show resilience to some cancers due to immune system behavior. Some dietary recommendations suggest that B+ individuals should consume more dairy and avoid grains. However, these claims lack solid scientific support. Additionally, a common myth links B+ blood to higher intelligence or creativity, though such beliefs have no scientific basis. In cultures like Japan, B types are often associated with passionate and individualistic traits, but these views are not scientifically grounded. B negative blood is one of the rarest types, found in about 2% of the global population. Like B+, B negative individuals have B antigens but lack the Rh factor, allowing them to receive blood from B negative and O negative donors while donating to B+, B negative, AB+, and AB negative recipients. The absence of the Rh factor requires B negative individuals to be cautious when seeking compatible transfusions. Genetically, B negative can be inherited when one parent has B or AB blood and both parents either lack the Rh factor or are carriers of the Rh negative gene. Studies suggest that B negative individuals may share similar health risks with B+, including a slightly higher chance of autoimmune disorders, though genetics and lifestyle are more significant factors. Myths about rare blood types conferring unique abilities lack scientific support. Nutritionally, Some theories recommend that B-negative individuals avoid meat and focus on vegetables and dairy, but there's no strong evidence linking blood type to diet efficacy. Culturally, in places like Japan and Korea, B-negative individuals may be stereotyped as independent or nonconformist, but these views are not medically supported and remain cultural notions. AB plus is the rarest blood type, found in about 3 to 5% of the global population. Individuals with AB plus have both A and B antigens and the Rh factor, allowing them to receive blood from any donor, making them universal recipients, though they can only donate to other AB plus individuals. Genetically, AB plus blood results from one parent contributing an A or AB antigen and the other AB or AB antigen, with at least one parent providing the Rh positive factor. This unique combination means AB plus individuals do not produce antibodies against A or B blood, facilitating transfusions. Research suggests that AB plus individuals may be more susceptible to memory problems and cognitive decline with age, but they have a reduced risk of heart disease due to the interaction of antigens with blood proteins affecting cholesterol levels and clotting. Mosquitoes may be more attracted to AB blood, although the reasons are unclear. Culturally, in Japan, AB plus individuals are often seen as rational and controlled, sometimes perceived as eccentric, reflecting diverse global beliefs about blood type characteristics, despite the lack of scientific evidence supporting these views. A B negative is the rarest blood type, found in less than 1% of the global population. Like AB plus, individuals with AB negative blood have both A and B antigens but lack the Rh factor, allowing them to receive blood from A negative, B negative, AB negative, and O negative donors, while they can only donate to AB negative and AB plus individuals. Genetically, AB negative arises when one parent contributes the A antigen and the other the B antigen, with both lacking the Rh factor. The extreme rarity of AB negative can make it challenging to find compatible donors in emergencies. AB negative individuals share many risks and benefits with AB plus blood types, but may have a lower risk of developing blood clots due to their antigen interactions with clotting factors. Research indicates that AB blood types are 82% more likely to experience memory and language difficulties, though the reasons for this correlation are unclear. Culturally, AB-negative individuals are often viewed with curiosity and considered creative and adaptable, though these traits are based more on folklore than scientific evidence. O+ is the most common blood type, found in about 37% of the global population. Individuals with O+ blood lack A and B antigens but have the Rh factor, meaning they can receive blood only from O+ and O- donors while being able to donate to any Rh-positive recipient. The genetic basis of O+ blood stems from the absence of A and B antigens, with the Rh factor inherited separately. O+ individuals are considered universal donors for plasma, making their donations particularly valuable in emergencies. Research suggests that O+ individuals may have some protection against heart disease and cancer, but could be more susceptible to bacterial infections like Helicobacter pylori, linked to stomach ulcers. Interestingly, they may also have a reduced risk of blood clots due to interactions with clotting proteins. Additionally, mosquitoes seem to be more attracted to people with type O blood, possibly due to body chemistry or odor. The O blood type diet promotes protein-rich foods, especially meat, but lacks strong scientific support, as nutritional needs are largely individual. O+ individuals are viewed as outgoing and confident, though these stereotypes lack scientific grounding. O- is known as the universal donor blood type because it can be given to anyone in need, lacking A, B, and Rh antigens, which minimizes the risk of immune reactions. However, O- individuals can only receive blood from other O- donors. This rare blood type accounts for about 6 to 7% of the global population, with its genetic inheritance requiring both parents to pass on the O gene and both to be Rh negative. O- blood is in high demand, especially in emergency situations and for newborn transfusions. Research suggests that O- individuals may have protective effects against severe malaria and a lower risk of heart disease compared to those with A or B types. However, they may be more susceptible to gastrointestinal issues like ulcers. Additionally, mosquitoes tend to favor type O blood, although the reasons for this are still being studied. While some propose that O-negative individuals should follow high-protein diets based on evolutionary theories, these claims lack scientific support, as nutritional needs should be tailored to individual health requirements. Culturally, O-negative blood is often admired for its universal donor status, and in Japan, O blood types are stereotypically viewed as strong-willed and natural leaders, fostering a sense of responsibility among O-negative donors.